I'm a doctor from Poland, and I'm a coordinator of aesthetic medicine studies in AMIR. Okay, so one more time, who am I? So I'm a doctor from Poland, and I will tell you everything about the studies. What is AMIR? AMIR is an international group specialized in postgraduate education and specialist training in the healthcare field at all academic levels. You may not know AMIR because it's widely known in Spain, not here in Poland. And what I need to tell you is that AMIR is a really big company, and they also specialize in education of young doctors who need to pass MIR, which is something like LEK in Poland. So the exam that every doctor needs to take if wants to get to specialization. So this is a really big company. Who can enroll for the studies? Those studies are dedicated for doctors. Unfortunately, they're not for dentists. So what do you need to have? You need to have a degree in medicine. You can also be be during your internship. So you can enroll while you are doing your internship. You just need a diploma from medical school. Any document any documents that are in Spanish for the doctors is not required. So you just need your Polish diploma. It is not necessary to have a specialty in medicine, and what is really important, you need to have a good understanding of English language. How long do the studies last? So they last 8 months from April till November, but you have the access to the platform in 9 months. What is the study mode? So it's a hybrid mode. The theoretical part is completely online, and the practical part is in Madrid. Okay, I will tell you more about theoretical classes. So there are 65 hours divided in 9 modules. They are recorded in high definition. They are available in the student area. So you will have a special platform dedicated for the students, and the classes can be viewed as many times as the student wishes. So we can always get back to any lecture that is on the platform. They're adapted and subtitled in English by native professionals. And also, what is really important, you can download 2 files. Actually, you can download the slides from each presentation, and also you can download the script. So after every lecture, you can have downloaded on your computer the slides and the script. So everything that the lecturer were saying during the webinars, the classes, you can have in a PDF file. When is the deadline for signing in for the studies? It's about 2nd week of June. What is the language of the studies? I have already mentioned that. So 90% is in English and 10% is in Polish. 10% in Polish, it's because there is a doctor who recorded the lectures in Polish, but it's like only 10%. Everything is in English. Also, the exams are in English, but you can also pass them in Polish. So the lectures, some of the lectures are in Polish, and also exams, some of them you can choose if you want to pass them in Polish or in English. What kind of diploma will I get after the studies? You will get double certification, one from Universidad a Distancia de Madrid with accreditation of Medical University of Łódź. How can I pass the studies? So the general structure of the studies looks like that. You have theory, modules from 1 till 9, and those are online classes. Then you have online practices, so tutorials, seminars, clinical cases on the platform. And after each module, you will need to pass the online tests. in English or in Polish. Then you need to write the thesis. The thesis is about 20 pages of the thesis on a topic that you can choose. So you can choose whatever topic you prefer. And after that is an international week of practice. And then you will have the 1 week of practical knowledge and of practical classes on the real patients with the really qualified doctors. How many students are in the class group? Of course, here we mean the class group while doing the practical week. So you will have 5 to 6 people in one class, and for this class you will have 1 doctor. So right now something more about practical week. Well, this practical week takes place in AMIR Aesthetic Medicine Clinic in Madrid. What techniques and procedures will you put into practice? You will have mainly everything. You will have lasers and other light sources, PRP, fillings, body mesotherapy, tension threads, hyaluronic acid fillers, Botox techniques, and microneedling, and many more. I will tell you right now about the program of the studies. So the program is quite wide, and it's divided into 9 modules, which I mentioned before. And the first module is general aspects of aesthetic medicine. Here you will learn about clinical history and diagnosis and evaluation of beauty, anesthesia, so everything that you will need to know about anesthesia while doing aesthetic medicine. Also cardiopulmonary resuscitation and other emergencies in aesthetic medicine, communication aesthetic medicine. So this is a general module. Module 2 is lasers and other light sources. Here you will learn how to treat vascular lesions, pigmented lesions, also how to get rid of tattoos, and which device should you use for collagen synthesis, and many more. Module 3 is very important, is facial aesthetics. Here you will learn about facial anatomy, skin structure, peelings, neurotoxins, bioplasty and volumization, so implants, fillers, and collagen stimulators, mesotherapy, microneedling, tension threads, PRP, fat removal under the chin, and also complications of aesthetic treatment. Module 4 is hair aesthetics, so a little bit of trichology. Here you will learn about hair follicle structure, also about the types of alopecia, capillary mesotherapy, and hair surgery implants. Module 5 is body aesthetics, so there are everything about the body, cellulitis, localized fat, lipotransfer, and many more. Module 6 is endocrinology and nutrition, and there you will have a little bit of endocrinology, diets, healthy eating, and nutrients and nutrition, because it's also related with the aesthetic medicine. Module 7 is global evaluation of the patient in aesthetic medicine. Here you will learn a little about facial and body plastic surgery, and also about psychiatry, psychology, and coaching. Module 8 is the aesthetic consulting room. So there you will learn about marketing techniques, management of an aesthetic consulting room, management of social media, and how to create your personal brand, because nowadays it's really important to have a personal brand and to work on your reputation. Module 9 is other aspects in aesthetic medicine. So ultrasound in aesthetic medicine, which is getting quite popular, and also aesthetics of the oncology patient, and the future of aesthetic medicine. Module 10 is master's thesis. So there you will need to write your thesis, and then you will have a practical week in Madrid. And here is the most important part. Here is the practical week. So I need to tell you that I have graduated AMIR studies last year, and the practical week schedule was a little bit different, and I worked with the management of an AMIR to make it really as much practical as it can be. So you will find everything, the good base of aesthetic medicine. Here you will learn everything. I will work on products from really well-known companies. Here you have everything, mesotherapy peelings, but also neck and neckline filler. You will have nanosoft. This is really good to know, those special needles. You will have dermapen microneedling, body mass therapy, a lot of fillers, so temporal fossa fillers, also lip filler in a young patient, lip filler in an advanced age patient. Also under eye filler, and something that is not so common in Poland, it's the nose filler, but they do it a lot in Spain. Also, you will have here great biostimulators. You will have hydroxyapatite, polycaprolactone, and polylactic acid, which are really important in aesthetic medicine. You will have a lot of botulinum toxin, the upper third, the masseter, so bruxism treatment, botulinum sock toxin for hypohidrosis. So I think it's a lot. Okay, and right now I need to tell you something about, my personal experience. I can tell you, as I mentioned, that I have graduated those studies last year. And what can I say? This was a really good time. I met many fantastic people. It's quite nice that you have 7 days in a row, and you spend so many hours with those people in one room, and you can come back to primary school somehow, because you are with those people during the classes and after the classes, and you are becoming a small family for this 1 week. What can I say about the practical week? Also, that we are having those classes with really advanced doctors. So I could ask everything. Actually, I was after some courses in Poland before I enrolled for the studies. So I had a base, and during those studies, I really, even though I had this experience, I got to know so many new techniques. And because the lecturers were so advanced, I could ask every question that I wanted, and they had the answer in a second. What else? We are practicing on a real patient, so in a group of 5 or 6 people, you can still do many things by your own, because there are a lot of patients during those classes. What else? You can also see the Madrid, and it was a really good time for me to be there. About the online classes, they are very detailed, so there's everything, everything that you should know as a medical doctor of aesthetic medicine, is there. And the really good thing is that it's online, and you can view those lectures as many times as you want. Okay, what I need to mention is that AMIR has also a second master, and this is a master in trichology and hair implant. And I will tell you about it really fast. What techniques and procedures will you put into practice? The capillary mesotherapy with corticosteroids, capillary PRP, laser, capillary cosmetics, post-transplant care. And about the surgical treatment, you will learn many types of surgical treatment, and many techniques of hair implants. And this is not so new for AMIR in Spain, but it's a new master here for the European students from Poland and different countries than Spain. So I can also encourage you to join those studies. And let's get to the Q&A, so questions and answers. I will switch my my view. Wait a second.